What's up, YouTubers? This is week 1 of my Achilles recovery, and just looking at my Achilles where it was ruptured. It's slightly swollen, but not as much. Only when you kind of touch it, it feels a bit painful. Other than that, it's been pretty good. Just a bit uncomfortable when you're going to sleep and you're wearing a heavy plaster. So I did go and see the surgeon, but the surgeon wasn't specializing in ankles. He more specialized in shoulders, elbows. So he said to go and see the other surgeon, which is going to be this coming Thursday. So throughout this week, I've kind of felt pretty sad because I was unable to kind of look after my baby. Can't really carry him around as well because I can't really weight bear on my left leg, especially going into the shower. I didn't actually get one of the shower chairs. I felt better kind of being closer to the floor when I am showering, so I actually got like this little stool that goes on the floor and I just sit on there. I wrap my plaster in a plastic bag so it doesn't get wet, and then I shower from there. Luckily we have one of those water thing, a long thing, so that I can shower myself around. So what I've done is I've upgraded my knee pads. I bought a volleyball knee pad from Rebel and they were $40. I'll show you what it looks like. So I got these ones and I just put them on my knees, and then you can actually go around with your just kneeling near the kitchen, so you can actually use your hands to grab things. So that's what I've been using. When I need to walk a bit further, I use my crutches. The crutches I'm getting used to. I was kind of getting pain on my shoulders when I wasn't used to it. Also on your wrist when you're holding the crutches, you get a bit of pain from there. Starting to get used to it, but some of my body as well, the muscles that I don't normally use on the right leg, it also gets a bit painful, but I'm starting to get used to that. I've also been just wondering if I should get the iWalk 3, and that kind of helps you walk around where you just kind of strap it on your left knee and then you can walk around normally, being able to use both of your hands. But I haven't actually gone around to buy it. So when I saw the surgeon on Thursday, I just asked him a few questions. At first I just wanted to be sure that without surgery, is it gonna be able to heal or will it take time? And I also asked the physio and surgeon, is it better for surgery or non-surgery? So the physio said that with the rupture rate now, before they were saying it was a lot more rupture rate with non-surgery than surgery, but now there's only like a 1% to 2% difference. So 2% rupture rate on non-surgery and 1% rupture rate on having it surgically done. Also the surgeon said, well, if you can rupture a normal tendon Achilles, that means you can easily rupture one that's surgically done, or one that's also non-surgically recovered. So pretty much almost done 2 weeks after this first week, and by the time I see them again on Thursday, I can finally go on boots, and that's what the physio said. And then from that, they'll be putting wedges on the boot. So with the boot, costs about $70, and I think with the wedges, he said it's about $20 each, and I think you start off with 3 wedges, and then they eventually move that week after week until you're able to put your feet flat, and then that's when you start to do physical rehab. So the surgeon did say if you went with a surgical route, there's the risk of wound infection and all these other kind of complications with the skin. It's not a lot, but it is still there. Even though I'm also young, I can easily recover from surgery, but with the thought of just getting all those infection, I didn't feel like going on the surgical route. So I think I'm deciding to just go with non-surgical, although I still have 1 more week to see the other surgeon, which specializes in ankles and Achilles tendon, to see what he says. But pretty much I'm just gonna go with the non-surgical just to avoid all those infections. You can also going into hospital, get MRSA and all those kind of things. But yeah, so I'm gonna go non-surgical recovery, and hopefully it'll only be a couple more weeks until I'm able to get out of the boot, and then be able to do my exercise rehab on my left leg. Yeah, so within this week, just a bit uncomfortable with the plaster. It's a little bit heavy, and also because I haven't been moving my ankles, feels like it gets a bit numb or swells up a little bit. So I've kind of just put my leg up and then kind of moved my toes as well. Also kind of just move it around a little bit just so that it's moving. Although I am still on Clexine injection, I did ask the surgeon if I can just get like some form of tablet, but they advised to get the Clexine injection, which is better for DVT, just to make sure I don't get any DVT, and to also see if I'm gonna go to get surgery. But yeah, I'm not gonna go surgery. So I have been doing a bit of research on some people who's having recovery on their ruptured Achilles. Most of them have done pretty well. Some have recovered and has gone to the sports that they've been doing in like a couple of months. Some people I think have not re-ruptured it, but kind of like had a bit of an accident and it became sore again. Then they kind of have to adjust themselves and make sure it gets kind of better again, which is like they go backwards another week because they kind of done something to it while just doing normal things. But other than that, yeah, a lot of people who's gone the non-surgical route, they've done pretty well and they've recovered and haven't actually re-ruptured their Achilles again. So I'll be seeing the orthopedic again on Thursday, and I'll see what he'll say. And thank you for watching my YouTube channel, and I'll see you on the next episode, and I'll give you an update on what's happening with my ruptured Achilles. Peace.